Mr. Lesniak, he's a fighter. He's one of these people that you meet that really embody the human spirit. He is a very bright man who was involved in a car accident that almost killed him.
I was a pretty healthy guy. I was always involved in the sports until October the 8th, when I had a very serious car accident that left me fighting for life, and it was quite a traumatic experience.
He's a survivor and a fighter, and in this unfortunate sequence of events, somebody found a lung cancer, and he was presented with another fight that he has to go through.
During that stay in the hospital, a pathologist came up and says that they found 2 centimeter diameter spot on my right lung. And that was the point where I met Dr. Hanna. What would be the advantage of the robotic technology?
If the pathologist looks under the microscope and he or she finds out that this is, like we suspected, a cancer of the lung, then we will go ahead and remove the entire third of the right lung so that we can give you a much better cancer operation and a much higher chance of cure.
Fantastic. That's great. That's encouraging.
Our commitment to Mr. Lesniak and to the hospital is that we are going to be as ready as possible for this day. With robotic surgery, we have enough precision to be able to find these very small tumors and to be able to do an adequate cancer operation with the highest level of precision and the least amount of blood loss that we know in technology so far, and that he will recover very fast, which is really the ultimate goal of this operation.
Traditionally, we used to do this kind of surgeries using a very large incision, opening the chest with a big retractor, retracting the ribs from side to side, going in with our hands and instruments, and while we would be doing a very good job, the outcome was that patients took longer to recover, and recovery was associated with more pain and more difficulties regaining back to the normal level of activity. The robotic surgery is a further advancement or further progress in this field because it allows us to be even smaller, more accurate, with less trauma to the tissues, and as a result, much faster recovery and hopefully a better treatment for the possible cure to lung cancer.
I was lucky to come out alive from my accident, and I know that I will be lucky, and God is watching over me to be successful after that surgery.
Thank you, Mike.
Right.
This is a great place not only for patients' care, which is a given, I think, but also with regards to our ability to progress and make a better job for our patients. We have a fantastic team of 4 surgeons. My 3 colleagues are young, energetic, very capable, very smart, and very research and patients' care oriented.
One of the really exciting things that we're happy to establish this Center of Robotic Surgery is we all see the common vision that everything we do here has the underpinnings of research and education. It allows our surgeons to be more precise and more accurate. I think that this is a phenomenal frontier and journey that we're about to embark on, and it is because of the visionary leadership and generosity of the Boris family that we've been able to take the St. Joe's surgical program to the next level.
Lung cancer traditionally is taken out through very large incisions between the ribs. People used to stay in hospital for many days, sometimes weeks, recovering from an incision. The robot, on the other hand, is very versatile inside body cavities. It has hands just like mine, and it can move in any different direction. And if you think of it in a simplified way, it's like having the surgeon's hands inside the chest. So you can do that safely, you can do that with having excellent 3D vision, and you produce a better operation as an end result of that technology.
It went very well. We could not be more proud. I think Mr. Lesniak will be happy.
based on lots of preparations ahead of time and discussions and communication. And I think once again it highlights the fact that we work very well as a team, we are well orchestrated. And I was very pleased to see that this surgery went as well as any other routine surgery performed in this hospital, which I think is a fantastic achievement for all of us.